Good morning, folks. Ron Ray here with Turning 65 Solutions. For today's video, we're going to be discussing a Medicare Advantage plan, that's Medicare Part C, that is designed specifically for veterans who also use the VA for some of their health care or prescription drug coverage. So if you recall, with Medicare Part C, Medicare Advantage, what happens is you continue to pay Medicare, the $148.60 a month for Medicare, but now Medicare sends a portion of that money, or sends all of that money, to the Medicare Advantage plan that you choose, and that plan combines your health care and administers your health care for you, taking Medicare out of the picture for that calendar year. So essentially, Medicare has contracted you out to the company that you choose. Now, most of these plans combine the prescription drug plan all into one plan and provide extra benefits that Medicare doesn't provide, like vision and hearing and dental and a health club like silver sneakers, or even some over-the-counter benefits. But there's one particular type of plan that's designed specifically for veterans. Now, anybody that qualifies for Medicare Advantage can get these plans, but they're designed for and work the best for veterans. So let's dive right into the details. Unfortunately, in this video, I'm not going to be able to give you the name of the company, but if you call us and we can have a quick discussion, I can legally give you the name and all the details about the company. But we'll go over the details of the plan, the benefits. So it's a 0 monthly premium. So that means that in addition to the $148.50 or $148.60 that you are going to pay Medicare, you will pay no additional premium for your plan. Okay, so it's just the $148. Now, this plan has a $975 deductible for in-network and out-of-network medical services. We'll talk about what that falls under here in a moment. Now, this plan is a PPO as opposed to an HMO. So PPOs typically have a much higher out-of-pocket maximum. Most of the ones this year in 2021 in our area in Texas, most of the PPOs have a $7,500 out-of-pocket maximum. This plan only has a $5,400 out-of-pocket maximum for in-network, and a total combined out-of-network and in-network of $6,700. For most plans, that number is $10,000. So the out-of-pocket risk is significantly lower. Now, it does come with some extra benefits, like the fitness club. It does have that. It's got 56 meals in 28 days for the meal benefit. Now, what that is if you have a surgery, you're in the hospital, and you return home from the hospital and you need help getting around, well, the plan here is going to have some meals delivered to your house so that you don't have to go out and about, and you can recover a little bit quicker. Ambulance services, $265 for an ambulance. It covers chiropractic. It covers some dental services, $2,000 a year for comprehensive dental. Diabetic supplies and services, diagnostic tests and lab and x-rays. You'll see most of them are going to have between a $0 and a $90 copay. Doctor's office visits. Here's one of the important benefits. For your family care doctor, your primary care doctor, it's going to be a $10 copay. Out of network, you pay 30%. So if the doctor's not in the network, you can still go see them, but you just pay a more. You'll pay 30%. So if the doctor bills $100, you pay $30. Specialist, you pay $40 copay, 30% out of network. Now remember, this is in one zip code in Texas, so these benefits are not going to be the same everywhere you go. I just want to give you an example of how they work. And in a minute, I'm going to compare it to a non-veteran style plan. It covers durable medical equipment, emergency care. It covers hearing aids, home health care. It covers outpatient mental care, outpatient prescription drugs, outpatient rehabilitation services, outpatient surgery. So you go have a day surgery where you're not spending the night in the hospital. That's only going to cost you somewhere between $40 and $295 for the facility fee. Substance abuse, over-the-counter items. you get $75 every quarter for over-the-counter items. So things like your aspirins and vitamins and allergy medications. You get a cold and you need to get some NyQuil. Well, you can get up to $75 worth of that type of stuff every quarter with this plan. It covers some foot care. Preventative services is all on the house, all your annual screenings, prosthetics, dialysis, transportation, 24 one-way trips a year. So if you aren't able to drive and take yourself to the doctor, this plan will pay for 24 one-way trips a year, really 12 round trips to the doctor and back. Urgent care centers, you need to go down to the little doctor's office on the corner just to run in for something quick. You'll pay between $10 and $40 for that. It does cover some vision benefits, some glasses. Inpatient hospital, $295 per day for the first 5 days. And now what you'll notice down here at the bottom is there's no prescription drug benefit. Okay, so this plan does not cover prescription drugs. And because of that, they are able to make the benefits up here, the medical benefits, a little bit richer. So that's where we have the $5,400 out-of-pocket max instead of $7,500. That's where we have a $30 specialist copay instead of $50. That's where we have $295 for inpatient hospital versus $375 for typical plans. And the way we're able to make this work is because veterans, most veterans, typically will get their prescriptions through the VA. And those prescriptions typically are pretty inexpensive. So we don't need to pay for other prescription drug coverage. So that is really the main thing about this plan, where it provides a benefit in lieu of another benefit. So your medical benefits are richer because they're not having to pay for the prescription drug portion of it. And if you're with the VA, you can have this plan and still go to the VA. You can still use your VA doctors, and you can still get your prescriptions through the VA. Now, again, I want to re-emphasize that the benefits that I listed here, these are for one zip code in one state. They will not be the same across the country. This plan may not even be available where you're at. So if you have any questions about this or want to know if there's a plan like this available to you, please give us a call. The number is 830-217-6711. Also, you can reach out to us on the web at www.t65s.com. So until the next video, folks, hope you have a great day. Bye.